So this is Frank Starling's law of heart, which states that force of ventricular contraction is directly proportional to the initial length of the cardiac muscle fiber within physiological limits. So just to understand this law, we need to understand few terms here. Okay. Now, when I'm telling a force of ventricular contraction, it is nothing but with what force your ventricle is contracting or pumping out the blood. So when I tell length of the cardiac muscle fiber or initial length of a ventricle muscle fiber is nothing but this is the length of a cardiac muscle fiber here. So individual sarcomere length is what we are talking here. So remember here when I'm telling when the ventricle is fully relaxed, the amount of blood present within the ventricle, we call it as end diastolic volume, which is about 130 ml of blood. So when the end diastolic volume is increasing, it means the length of the cardiac muscle fiber is increasing. It starts stretching out like this. So the ventricle muscle will start relaxing. So the length of the muscle fiber will keep on increasing. So now, according to this law, what it states is that when the end diastolic volume increases, the force with which your ventricle contracts will also increase. So it is something similar to like a rubber band. The more you stretch a rubber band, the force with which it snaps back is also more. But it happens up to a particular limit, because after a limit, if you keep stretching a rubber band, it will snap or it will break, right? So similarly, your heart also, up to a particular limit, if I keep on increasing the blood in the ventricle, the force with which it contracts also increases. So just see here, when the venous return increases, end diastolic volume increases. That is nothing but the preload is increasing. Preload is nothing but it is a load acting on the heart even before the ventricle starts contracting. It means amount of blood which is present within the ventricle now. So because the load is increasing on the heart, the ventricle sarcomeres are stretched to a optimal length. Because of the increase in the ventricle sarcomeres optimal length is increasing, what happens is there is more interaction between actin and myosin fibers. So the force of contraction increases. This increases the stroke volume. When you consider it for 1 minute, your cardiac output increases. Stroke volume is nothing but amount of blood ejected out of ventricle for one contraction, meaning out of 130 ml of end diastolic volume, once the ventricle contracts, about 80 ml of blood goes out. That contraction or ejection of blood per beat, we call it as a stroke volume. So indirectly you can remember this Frank Starling's law of heart as fuller the heart, stronger would be the beat of contraction of the heart. Now what is the clinical relevance of this is, in heart failure patients, the Frank Starling mechanism is impaired. So the force of contraction is reduced.